The person living with dementia may not remember the day, but they can enjoy the moment. I'd like to acknowledge the traditional owners of the land on which we meet today and pay my respects to the elders, past, present and emerging. Thank you. What would have helped you as a carer? Have you ever thought about going to a carer support group? Not for everybody, but they can be a very useful tool for educational.
I think I've been to one, but it's a time factor thing with me. Because I've retired from work and I'm trying to get myself sorted, but I have to fix sister up first. And there's so many things that I want to do, but I've got to prioritise what I want to do. And carers support group would be wonderful, but I can hand the baton to my niece when she's well, and we can all kind of go and, because we are basically all carers. We care for each other, but we care for sister, and it's not all focused on her, it's focused on us as well. Yes, we're going to have self-care as well. We have to take care of ourselves, otherwise we're not going to be any good to anybody.
Well, carer support groups often provide education about other service providers, things that are available, dietetics, looking after your own mental health, also medicines, where pharmacists come in, all sorts of people from all around the place. As I say, not for everybody, but can highly recommend the camaraderie that's there. People find talking with others who are in or have been in the same position can be very comforting. But your local town or your local dementia support should be available for you to access.
We've had the nurse come in, the chemist lady. She's a past chemist. She comes in and checks all the medications. We've got a very good person down at Linda's chemist. Fixes everything up for her. Then a nurse comes in once a month, I think. Checks her blood pressure, checks her, all of her weight and all of that. And are you drinking enough water? Are you doing all of this? And then we have, the girls, the personal care, and then the domestic assistance and social support. That all goes in with her all week. Then weekends, she might say, leave me alone, I've had enough. Or she might want company and we'd take her out and do stuff and that, But there's a lot of activity around for her. She'll go, she's at lunch today, but she'll come home and may come to my place later for dinner or whatever. Or whatever, one of us will pick her up. So she's got a bit of a social life.
Probably better than mine.
Yep. But it's just, she still does a bit of washing on her own, but the girls, the service provider coming in, might do it and she'll hang it out. So she hasn't lost all of her independence, but she's staying where she's put at the moment because she's got a lot of family support and community support.
And I think that's lovely.
Yeah.
Do you know, more people don't go into care than go into care when they have dementia.
But on the other hand, we are looking at some respite.
I think that's a very good idea.
We need to go, otherwise we're all getting older. Like the youngest one of our siblings is 63. So she's there as well. And we have people coming and checking on Auntie and what have you, but we have to look after us in order to look after.
Absolutely.
And she started to, I'm not going to respite. I said, well, you don't have to, but you can take Dusty. So I kind of bribed her a bit. It's just,
Dusty's the dog,
Dusty's a beautiful little dog.
so he's allowed to go to respite.
She's the baby.
And was it a hard decision to make?
For what?
To
Think about respite.
I think it could be good for them. We're not going to push a distance because they take them out on activities.
yes.
They do activities at respite, and I'm going to take her up and introduce her to some of the people up there because I know them, and I think she'll like it.
I think
I'm
she
not going to
will.
push her into it, but it's going to be better than sitting around because she does colouring in sometimes, the colouring in books, and she was doing crosswords one stage and finder words. But I don't know that's, even the footy cards have been put away. So now it's just TV and the dog.
Here in New South Wales, we have a thing called the Carer Gateway, which is part of Carers New South Wales, and the carer registers, and they can help with things like the respite, or if she wouldn't go to residential respite, with some in-home respite and different things that might give the family a bit of a break over a short period of time. That's something that could be useful.
Yep.
Each state will probably have their own organisation, and obviously we're here in New South Wales, so that's the one I know best. With service providers, it's obviously something you've both used and been aware of and support. Would you encourage people to get involved?
Oh yes, have a package, and Linda's on I think it's a level 3 now, and she's doing really well on it. This vital call alarm is covered by that. Everything she's getting now is on a package. On a package, and you mentioned Carer Gateway earlier. I've been in touch with Carer Gateway, I'm aware of who they are, and we'll be using them as well in the future.
Dementia Australia have support. They're Australia-wide. They have a dementia helpline, which is 24/7, and anybody can phone, not just for a crisis or anything, but for advice, for support, to talk to a counsellor. They have a library that you can borrow books from, and some that'll be culturally appropriate. They've done a lot of work on that. Anybody can phone them. There are other services, and attached to these videos will be a list of the common places to look for resources and help.
I found the service provider, especially a package, like they might come in the morning and they might stay up there so you can have a shower and know that you're safe. You know, you haven't slipped over or fallen over while having a shower. And then they also might do their morning medication.
Yeah.
You know, and then they might have someone come around and do Meals on Wheels. And those who come around and does the Meals on Wheels is also seeing that the person is okay. So I found that really good for someone to come around and just check on them, maybe different one twice a day, or if you're a working person.
Yes, because you can't not work. If you are a working person, you can't just take time off every time you need it. And I think having care providers can just help bridge that gap.
There's people going visiting all the time. She's got someone there, and I think she gets sick of us. Leave me alone, I'm right. You know, when she had the fall. But, yeah, and she's used to that little space. That's her home, and that's where
But
she
you
will
respect
stay.
that, and I think that's amazing. Some people don't.
Oh, no.
Some people don't.
Me and sister went and stayed for 2 nights. We're only allowed to stay 2 nights. See you later. So we're okay while we're cooking food and helping her with it. Well, she was able to clean up and that. But we cook feed for her because she doesn't cook anymore.
No.
So we make up little meals and make up, when she sees all them food, like, well, time to go home now.
Is she in a routine? Like, is she...
Well, when she goes to exercise with Armagen, but she couldn't go. And she goes to Elders today, and then there's women's group tomorrow. Friday is the only day she has off, because on Thursday she goes shopping or social support. Then Fridays she doesn't do anything. But weekends we might go and pick her up.
See, I
or
think
something.
people don't realise that support services can do things like that. Take them shopping.
Yep.
Take them to social things like going to the raffles at the bowling club or going to, for gentlemen, I've known a lot of gentlemen who've gone out to the sale yards on a Thursday. Yeah. Well, for us it's Thursday, and they go to the sale yards and watch the cattle and the sheep being sold.
Yeah.
Because they're old cockies or they've worked on a farm or been a jackaroo or something, and that takes them back to a happy place. And just to be amongst all the men, no women allowed. And it's amazing how it can just change someone's feeling from a bit depressed to actually, I'm somewhere I feel comfortable, and I know of someone who used to be in a care home and they had a saddle in their room and the staff would help him get on the saddle. Yep. He knew he wasn't riding a horse, but he just loved the feel of sitting in the saddle. So it's finding those things that bring those moments of joy and pleasure, can make all the difference. Now, I've asked lots of questions, ladies, so have you got any questions for me?
I did talk to you about Care Gateway previously, and I did ring them, and because I've spoken to our siblings and that, I said, what do you reckon we put her in respite for a little while? But I asked her first, and at first she said, if I can take Dusty with me. I said, they take you out and do bus trips, there's activities within the residential home up there where I was. And she hummed and ahed about it, and then she said, no, I'm not going. So I just let her go.
Yeah, and then you bring it up another time.
If she decided to change her mind, what I'm going to do is get some paperwork and show her, this is what's going to happen. You might know some of these people.
I'd take her up, talk to them and take her up for the cup of tea like we've talked about, and maybe ask the GP if he'd be prepared to suggest that he'd really like her to have a little break.
Yeah.
And sometimes when it comes from the GP, not the family, they'll accept it, especially when those of us that are older, we're used to trusting our doctors and listening to them.
And I think, given the winter time, she's just going to sit. She has the chair exercise. She has all these exercises that were given to her. I even do them. But I said, you can't just sit all winter and in the summertime out and about all the time. In the winter time, if she goes to respite and goes on a trip, on a day trip or wherever, that could be good for her. And going home, doing something different. Doing something different and breaking that monotony in your life.
And you'd be surprised how she might enjoy it.
Oh, look, I think it'll be good. But that's me. That's what she thinks. And I'll say, come on, we'll go up and check this out.
Yeah, I'd do that. I'd go up and check them out and see, because I've had other people who've taken their loved one up just for a cup of tea, just for the tea time, morning tea, and then they go home, and then a week, next week they go up again, so that by the time they do their respite, they're familiar with the staff, they're familiar with some of the other residents, and they're familiar with a bit of the routine, and the grub's not too bad. It's just finding the right place to suit the person.
And she did she thought about, it could be good. I said, it's up to you.
Yeah.
It's her choice, it's her thoughts.
Yeah. And I think that's wonderful of you all to do that too.
Yeah. And
because if you push her, she'll just push back.
Oh no,
and it'll never be a good thing. It's a bit like not arguing with somebody living with dementia, because you'll never win.
You don't argue, I know that.
And all it does is make you frustrated and cranky, them frustrated and cranky, and you both lose.
Having said that, it's like Valerie was saying, it teaches you more patience. It helps you self-care, because you think, I'm not going to fight with you because you're only just going to drain my energy. This is what my thoughts are. It's like banging my head against that wall over there. So if you say it's raining outside and it's not, I'll say, yeah, it is.
Exactly.
Because we just need to go with her, you know. And you can't let anybody drain you. And I mean, some people test your patience. They do. And I just know, well, it's okay. You don't have to do this. But we just want you to be safe and happy. Mm-hmm. But yeah. So when I go and see you this afternoon, I'll say, how was the elders? Good. Was it good? Oh, no, it was real good.
Yeah. Yeah, that's one thing I found.
She'll tell you, it was real good.
Thank you, ladies. I think
Thank you.
You've shared so much, and it's so appreciated. And you're just wonderful. So thank you very, very much indeed. And I hope you've all enjoyed watching the video.